Hello, everyone, and welcome to our ISPCAN webinar. My name is Jane Estes, and I'm the ISPCAN Knowledge and Content Development Manager. Also joining us online is Holly Malcolm, our ISPCAN Membership and Marketing Manager, and Pragathi Tamala, ISPCAN CEO. ISPCAN's international webinars cover diverse topics which are presented by subject matter experts from around the globe. Many of our webinars are hosted with key partners, like today's session with SVRI. These 90-minute webinars are designed to help our members and partners gain access to knowledge and expertise to inform care, improve practice, and drive policy change. All of this is critical to help improve the outcomes for children globally. We hope you'll consider joining us in Vilnius, Lithuania for our International Congress, October 6th through 9th. We'll be bringing together the brightest minds in child protection from every sector to innovate and share best practices. The program is now live on the ISPCAN website, and registration is still open. And because we believe that you should have access to all the information and resources available to support you in your work, we encourage you to visit the ISPCAN Knowledge Hub. The Knowledge Hub is an open access, centralized library containing ISPCAN and partner resources. This user-friendly hub features our webinars, our journal clubs, masterclasses, data-driven global reports, and shared partner and downloadable resources. If you have an open access resource or program that you would like shared in the ISPCAN Knowledge Hub, please email it to me at partnerships@ispcan.org. And now tips for making the most of today's session. Just please engage with us. This is meant to be an active, interactive learning platform. Please participate by sharing your comments in the chat and your questions in the Q&A box throughout the webinar. We're going to use your questions to begin a Q&A session immediately at the conclusion of the presentations. And to enhance your experience, you can enable closed captioning on your Zoom control bar by choosing Captions. And as always, for joining us today, a recording of the session, presentation slides, links to featured resources will all be sent to you after the webinar. And now please take a moment, introduce yourself to other attendees, our ISPCAN team, and our featured presenters in the chat box. Let us know where you're joining from and your organization and your discipline. We have over 90 countries represented in the audience today. And today's topic, violence across generations, what we know and where do we go? In partnership with the Sexual Violence Research Initiative, this special webinar will share and discuss the research findings on the intergenerational continuity of violence from a longitudinal and multi-generational mixed method study. Effectively addressing interpersonal violence against adults and children and its root causes at scale requires collaboration and partnership across a range of organizations and sectors. After sharing key findings from the study, the Interrupt Violence Project team will help us identify next steps for action to address risk factors and amplify the positive potential of protective factors for violence. Specifically, our key learning objectives for today's session are to understand which mechanisms underlie the intergenerational continuity of violence in South Africa, to describe the linkages between violence against children and violence against women, and identify how these findings can inform and shape evidence-based interventions and prevention strategies, and to explore how research insights can translate into actionable recommendations for policy development, advocacy, and cross-sector collaboration to address, and most importantly, to interrupt cycles of violence across generations. And now to meet our presenters. These key members of the Interrupt Violence team will be leading today's webinar. They will each introduce themselves and share their role in the study and key insights from their area of expertise. At the conclusion of the presentations, additional members of the research team will join for an open discussion and a live Q&A. It is my honor to turn the session over now to the Interrupt Violence team, and to specifically Franziska Minnick from the University of Edinburgh, who will begin today's session with an introduction to the study and its methodology.
Great, I'm just getting my slides up. There we are. Is this working?
It's perfect. Thank you.
Great. Thank you, Jane. Thank you for the introduction. And thank you for coming today. I am so thrilled that you are all here today to listen to our initial results and our emerging results. First, I would like to thank all of the participating universities for all the support that they have given us, and the funders, ERC and GCRF, who have made this research possible. We have 5 presenters here today, but we only have one slide deck, so don't worry. I will be going first, and then my colleague, Dr. Hannah-Beth Franchino-Olsen from The Ohio State University, will be presenting next, together with Pamela Malalicke from the University of the Witwatersrand, and Dr. Nicola Christofides from the University of the Witwatersrand, and Dr. Natalie Willett from the University of the Witwatersrand. You can see we have a strong collaboration here with the University of the Witwatersrand. And then we have our panelists later on, Dr. Mpo Selima from the University of the Witwatersrand, Dr. Kopano Munaiza from the Northwest University in South Africa, and Dr. Christina Thurston from the University of Edinburgh. Today's presentation is on intergenerational violence cycling, or sometimes we also call it the intergenerational transmission of violence. And we talk about intergenerational violence transmission or cycling when an infant or a child who's experienced violence is more likely to experience violence and perpetrate violence as a youth. And then they are also more likely to experience and perpetrate violence as an adult. And that affects their parenting and their relationships and the next generation. So here we have the intergenerational violence cycle. We know from previous research that the risk for victimization triples in children who have already experienced child abuse. And we know that 1 in 5 who've experienced violence in childhood go on to perpetrate violence against a partner or against their own child. There are many theories and mechanisms for the intergenerational continuity of violence that have been mostly hypothesized. So there's social learning theory, where we say that children normalize violence through witnessing or experiencing violence. Then there's also the thought, and also some evidence for that, that those who have experienced childhood abuse, it has affected their mental health with a greater likelihood of depression, anxiety, and post-traumatic stress disorder. And that then is linked to a higher likelihood of IPV victimization and perpetration, and poorer parenting. We also know that childhood abuse affects parenting. So those who experienced inconsistent discipline have difficulties responding to children's needs, and an over-reliance on children to meet their emotional needs as adults. They're also more likely parental over-involvement and authoritarian or permissive parenting, and that gets continued across generations. So these parenting cycles continue. What we also know is that unequal gender power relations between men and women, as well as inequitable gender roles and norms, play a really critical part in the use of violence, particularly against women and children. And social inequality and poverty are closely linked with intergenerational violence continuity, together with intergenerational trauma. The evidence for the intergenerational transmission of violence is substantiated in a vast scope of research, mostly from high-income countries. But the results are mixed for some studies on account of some methodological limitations. So, for example, we're lacking longitudinal data, and mostly we are using or relying on the response of one or two respondents within the research. So we don't have multi-generational studies, very many of them anyways. So we decided to do a multi-generational longitudinal study. And today I'm mostly going to be we are going to be mostly presenting on the intergenerational aspect, not so much on the longitudinal aspect. And we started in 2010 with adolescents that were randomly recruited in one province in South Africa, in one health district, through randomly selected census enumeration areas. They were aged between 10 and 17. And we re-interviewed them 1 year later, when they were 11 to 18. And then now conducted a 12 to 14-year follow-up study. It was quite hard to find them, but we managed to get almost 80% retention in our 12 to 14-year follow-up. And in addition to these adolescents who are now young adults, we also decided to include their former primary caregivers and any children that they had aged 6 and above into the study. And in order to also really understand underlying mechanisms, we then also decided that we were going to do a mixed methods approach. So we did some in-depth interviews, qualitative interviews with 30 of these young adults, their caregivers and children. And you can see there's not the exact number of caregivers and children in the qualitative, because sometimes we only had a dyad between a caregiver and an adolescent, or like young adult now, or a caregiver and a child, or a young adult and a child, depending on who was still alive and who was willing to participate. And these qualitative participants were selected based on their responses in the quantitative survey around violence and how much violence they had experienced. And then we did another in-depth round of 7 complete families. So this is triads and 1 quadruplet, where we really were looking at intergenerational effects and how these intergenerational effects came about. Our study took place in Mpumalanga. It's one of South Africa's 9 provinces. You can see it here with the blue arrow, in peri-urban and urban and rural sites. And these sites are characterized by high level of poverty and food insecurity, high levels of unemployment, poor mental health, and very poor service delivery, particularly around justice, health, education, and child protection. And there's also quite a poor understanding of child and adolescent development, in the sense that people are unaware about what types of behaviors are normal for certain stages of child development, and they see them as being disobedient, as challenging authority, and that need to be punished, and that need to be controlled. And children always have to do what their caregivers request of them. The aim of the study was to understand the mechanisms and risks that drive intergenerational transmission of violence across multiple generations in South Africa. Our methodological approach was multi-pronged, so we started with tracing and verification of the original participants. Then we went through consent procedures with them and proceeded to interview for those who agreed. Once we had interviewed, we asked them for consent to contact the former primary caregiver and to interview their oldest child if they were aged 6 and above. And it has to be said that these might not be biological children, but they are children that they care for like a parent. We then got consent from the caregivers and assent from the child to interview, and then interviewed the caregiver and the child. Our study received approval from all of the involved universities, ethical approval from all of the involved universities, and from the Mpumalanga Department of Health through a very protected ethical approval process. In the survey questionnaires, we asked our young adults and the caregivers about their relationships within the household and with their children, the types of violence that they were experiencing and perpetrating, different types of health outcomes, risk and protective factors, and social protection. So the kind of government services that they were receiving, like, for example, a child grant. For children, we had a very similar questionnaire, only the questions were child-friendly, and it was much, much shorter and used a lot of arts-based and arts-involved methods. For the qualitative interviews, we warmed participants up with squiggle drawings and also used arts-based methodologies. So, for example, we used kinetic family drawings, a river of life approach, and sandboxing, depending on what the participant preferred and also what we thought might be suitable for the participant. It depended a little bit on how the early communication went. And then, guided by these drawings, we conducted in-depth interviews to really understand what was happening in these families, over generations. As you can imagine, there's a lot of participant need in our study. So in total, we had 1,358 referrals, and they were triaged by our 2 study social workers, who then decided according to need who was being seen. And 765 referrals were attended by study social workers throughout the course of the 2 years that we were in the field. Approximately 1 in 5 had multiple visits, and you can see here on the right-hand side the different types of issues or problems that our social workers might have visited a family for. If you are interested in the in-depth overview of the methodology, we have published a protocol for the study. It's also available on our website, and it is open access. So please feel free to read up on what we have done and check what we have engaged in for the study. Now to our participant characteristics. 25 years was the mean age of the young men and women that we interviewed in our study. More than 1 in 3 experienced food insecurity, and 2 in 3 had completed matric. And matric is the highest school qualification that you can receive, so grade 12 in South Africa. Our young adults experienced quite a lot of violence. 69% experienced physical, emotional, and/or sexual abuse or neglect in childhood. 32% witnessed violence between adults in their family of origin in childhood. 46% of young men had ever perpetrated physical, emotional, and/or sexual intimate partner violence against a partner, and 34% had ever experienced physical, emotional, or sexual violence by a partner. We measured IPV perpetration by young men and IPV victimization by young women. That's why we're not reporting on both of them. In relation to young adult participant caregiving, 76% of women and 40% of men reported caregiving for a child like a parent, and nearly 8% had lost a biological child. So we have high percentage of child loss, but also very disparate caregiving arrangements or parenting arrangements where women very clearly carry a vast amount of the caring burden for children. 38% of the females in our study had their first pregnancy before the age of 20, which is fairly much in line with South African prevalence statistics nationally. So there's very high numbers of adolescent pregnancy in South Africa. As we're moving into our results, I just want to highlight that the focus of our analysis is sex assigned at birth rather than gender identity, just to make that clear. We have a lack of men who are caring for children in South Africa, as we've just seen, and A lot of the results today are pertaining to women and women's parenting behaviors, but we intend no blaming of women or their parenting behaviors. While a majority of analysis focus on women and their parenting, this is often conducted, or the parenting is in very, very difficult circumstances, and we really need to take that into consideration when interpreting the results. What we also have in the study is many multi-generational households. So there might be more than one primary caregiver across generations. So for example, the biological mother and grandparent might be living with the child in the same household, and we have not taken that into account in this analysis. And the voices of young children are not typically prioritized, which is why I really wanted to do this in this presentation. And we have tried to do that by recruiting children aged 6 and above, but keep that in mind again when you're seeing the results. We're talking about very young children here. Thank you, and I'm handing over to my colleague, Hannah-Beth Francino-Olsen at The Ohio State University.
Thank you so much, Franziska. So to start off today, Pam and I are going to be discussing our findings on violence against children, drawn from the quantitative and qualitative samples of the children in our study. And I'm going to present the quantitative findings first. So these findings come from data that were collected via child questionnaires, and those were interviewer-led questionnaires done with children in the quantitative sample. The questionnaires were designed to be play and arts-based, which allowed us to interview and include children as young as 6 years old. Among the many measures in the questionnaire, we asked children to report on their experiences of violence, which included violence from caregivers, in the household, from peers, and the community. We asked about their mental health symptoms, including trauma, anxiety, depression, and suicidality. And we asked about their home environment, their community, their health, their conduct, etc. For the findings I'll present today, we calculated the prevalence of child-reported violence and used tests to assess difference across age and gender. We also considered connections between violence and mental health via multivariable regression models. So looking at who were the children in our sample, we had a sample of 280 children made up of slightly more girls, 55%, than boys, and the mean age of children in our sample was 8.8 years. Most of the sample, 68%, were in the youngest age group of 6 to 9 years, while 22% were in the middle age group of 10 to 12 years and 10% in the teenage group of 13 to 17 years. And the analyses were guided by the research questions asking what is the prevalence of child-reported violence across various contexts, how does it vary across age and gender, and what mental health measures were associated with these experiences of violence. So we will start off looking at the prevalence of violence that children reported, starting with the violence they experienced from their caregiver. 55% of children reported instances of physical abuse, and of that 55%, 83% were hit with an object. So that was a very common experience. And 19% experienced physical abuse so severe that it left an injury or a mark. 56% reported emotional abuse, and 8% reported deprivational abuse, which was measured by asking whether they had food or meals withheld as a form of discipline. Overall, when considering all these types of caregiver violence together, 75% of the sample reported experiences of violence from a caregiver. If we zoom out to what children told us about the household level, 21% of children reported experiences of repeated sibling violence, and 39% reported witnessing or experiencing violence between household adults. When these additional types of violence are considered alongside caregiver violence, 84% of the children reported experiencing violence at the household level. And zooming out once again to the community level, 53% of the sample reported experiencing repeated peer violence, 6% reported sexual abuse, and 27% reported experiencing community violence, with 17% having been attacked in their community and 15% having witnessed an episode of community violence. So taken together, considering caregiver, household, and community violence, 91% of the sample, 91% of the children in our sample had experienced violence. When we consider these violence experiences by age and gender, we found the following patterns. And I'm only going to report here the differences that were statistically significant. Boys were more likely to be hit with an object than girls, though I will note that it's high for both groups, 90% for boys and 77% for girls. Girls, however, were more likely to experience repeated peer and sibling violence than boys. By age, using the age groups of young, middle, and teen children, physical abuse was more commonly reported by young children than older children, and witnessing community violence increased with age, with 11% of young children, 20% of middle children, and 33% of teen children witnessing community violence. When examining patterns in mental health measures by age and gender, the scores for anxiety and depression increased with each age group, and suicidality was significantly more common for teens, 23%, than middle or young children. We also asked children questions about their views on violence against children. So in responding to a scale that assessed whether children had accepted norms or held views that supported family violence, items on this included questions like fighting is the only way to solve problems, or sometimes people deserve to be hit. Children showed a moderate endorsement of these family violence norms. When asked how they felt about violence between adults in the household, 75% said they felt scared and 23% said they felt at fault for the violence. Half of the sample believed that if there is violence between adults in the household, that children should tell someone about it. Finally, I want to present the findings from the regression models that investigated the associations between violence experiences and mental health, specifically trauma, anxiety, depression, and suicidality. And I need to note that these models control for the contextual features of a child's home and community, and that included things like demographics, education, conduct, household characteristics, parental stress, and acceptance of family violence. Those are all noted there at the bottom of the slide. I'm also only going to highlight the relationships that had a significant positive association between the violence experience and the mental health item for the full model. There were some other meaningful associations in the less complex models, but we're only highlighting the full model results here. So for example, sexual abuse was associated with some of the poor mental health outcomes, but not in the full model, and that was potentially due to the low prevalence of sexual abuse reported in the sample. So looking at these regression results, sibling violence was associated with children's trauma score, while peer violence was associated with trauma, anxiety, and depression scores. Experiencing violence between household adults was associated with suicidality, and being attacked in their community was associated with trauma. And I want to note for the trauma, anxiety, and depression results, these are score measures, so they are increases in odds for each additional point on that scale score. Though they are not VAC-specific measures, unsafe people and spaces were also accounted for in the full models, and it's worth noting here how unsafe people are significantly and positively associated with the trauma score, and how unsafe spaces are associated with the anxiety score and with suicidality. So with that, I will hand it over to Pam, who will talk us through the qualitative findings.
Thank you so much, HB. So I'll be taking us through the qualitative findings. And basically what we wanted to know are two things. First, what were children's descriptions of the violence that they experience? And secondly, what are children's perceptions of the violence that they experienced? We spoke to 23 children who were aged between 6 and 12. Most of them were girls, as you can see here, 52% of them. And most of them, both boys and girls, were aged between the ages of 7 and 8 years old. We used in-depth interviews, which were supported by the arts-based methods that Fran took us through, all of them excluding the River of Life. So the quantitative findings really supported what children shared with us about their experiences. So for the purpose of this presentation, we'll just be looking at the perceptions of violence. And here are the different themes that emerged from the data that the children offered. First, the emotional burden of experiencing violence. Secondly, violence is a moral act, but it is painful, which shows cognitive dissonance. Third, there should be other ways to discipline children. Lastly, confident in reporting peers but not adults for acts of violence. For the last theme, we won't be going into detail in it for this presentation. However, in this case, children found it easier for them to report cases of violence that were inflicted on them by their peers, whether siblings or their friends, as opposed to when the violence was inflicted on them by a parent, teacher, or other caregiver around them. So we will now zone in on the three first themes here, just to hear exactly what the children said. So for the emotional burden of experiencing violence, physical and emotional violence were often treated as the same as the normal way to discipline children, even for small mistakes or typical age-appropriate child behaviors. For kids, this was so confusing because they didn't understand why it was happening. And on top of that, it was hardly ever followed with a verbal conversation to guide them on how to change their behavior or to just show them exactly what they had done wrong. For example, when this child was asked, "Uncle would hit you, why would he hit you?" He said, "I do not know." The interviewer then asked, "According to him, what would you have done?" He says, "I would not have done anything. I took a chair and I sat on top of it. I went to call grandmother to tell her something is burning. When I came, I found the shoes on the chair. I took them and put them on the bed. Uncle got angry and he hit me." The interviewer then says, "Oh, sorry, how did you feel when Uncle hit you?" And the child says, "I did not feel any better." And now for the second theme, violence is a moral act, but it is painful. Here, children hold two opposing feelings, where this is confusing for them because this violence is often inflicted by parents, teachers, caregivers who are meant to take care of them. This leads to somewhat a state of normalization or acceptance of it taking place because it's going to take place anyway, and the person who's doing this to me is someone who is supposed to love me. So this participant says, "However, I let it go because she is still my mother. It doesn't matter whether she shouts at me or hits me, she will always be my mother." Additionally, children were also aware of the different power hierarchies that exist, whether at home or at schools, and their inability to defend or challenge the established order themselves because they're of the position of the person who inflicts the violence, who in most cases, whether it's a parent, an older sibling, a teacher, they hold a higher position as opposed to them. This one child says, "It hurts because the other person is older than the younger one. The young one cannot fight with the older person." And now we move towards from playing to violence. And this is a case where we see peer on peer violence. Children often imitate this behavior by resorting to physical aggression, such as hitting or other violent actions, as a way of expressing their frustrations or displeasure towards their peers, instead of using words to communicate their feelings because this is something that they see adults doing to them, or even adults doing it to each other. This one child says, "My friend choked me. We were playing together and he started teasing me and said I was too forward." Too forward meaning that the child was acting better than their age mates or doing things differently from them. And then he choked me. And we also see in some instances, children use violence also as a way of conflict resolution as opposed to talking things through. This one child says, "I got sent to the staff room for beating up another learner." And the interviewer asks, "What made you beat them?" And he says, "He threw me in the mud. After I punched him, he got a black eye." And he was asked, "Why did you punch him?" He says, "I punched him because," he points to the angry face, the feeling faces games that we had. He points then to the angry face to show that he engaged in this violence because he felt angry. And that just wraps up the three themes that we're focusing on this presentation. But now to put together the key findings from both the quantitative and the qualitative findings. Firstly, violence was experienced across different settings and from varied sources, which took away children's sense of safety because it's happening at home, it's happening at schools, it's happening even within their communities and from literally anyone around them, whether it is a parent, a sibling, a friend, or a teacher or any other caregivers. In addition to that, corporal punishment was frequently reported by children, and children were often hit with objects. This objects range from sticks, pipes, belts, or in some cases, anything that was within reach. And moving on, there were power hierarchies that determined if and how they disclosed and sought for violence. Like I said earlier, they felt comfortable in disclosing violence that was inflicted on them by a peer or by a sibling, someone who's in close age with them and someone who don't recognize their power hierarchy as higher than them, as opposed to when the violence was inflicted by an adult or someone who was supposed to care for them essentially. And moving on, children carried an internalized blame for and fear of violence in the home, even when it was not directly witnessed. In some cases, this violence would be happening in the room next door when they were sleeping, or it would be criminal activities that they either heard about from adults around them or from their friends. And this led to many accepting violence as a way to teach others or to self-conflict. This was used in peer relationships and with the potential of them carrying it forward into adulthood as they grow up. And finally, the physical and emotional violence placed a strain and created a distance between the child and the caregiver. And this was a result of the painful and internalized blame that the children carried with them. Thank you very much. I'll now hand over to my colleague, Nicola.
Right, thanks, Pam. So I'm going to be talking about intergenerational cycling of violence in the home, looking at pathways between child abuse, intimate partner violence, and the use of violence against children amongst young women and men. So in particular, what we were interested in doing is looking at answering the question about what pathways connect childhood abuse exposure in the home to their partner violence experiences or perpetration in adulthood, to the use of child abuse. And we specifically wanted to develop and test an interactive theoretical model of the pathways underlying intergenerational violence within the South African context, building on the theory that Franziska explained in the first presentation, the theoretical underpinnings and what is already known about the cycling of violence. So we created some intergenerational outcomes that were mutually exclusive for this analysis. They were based on experiences of abuse in childhood inflicted by adults or caregivers based on the ICOST-R, and it included physical, emotional, and witnessing of violence in the home. Intimate partner violence experiences and perpetration that was measured through the WHO multi-country domestic violence measure, and the infliction of violence, both physical and emotional, against their own children using the ICOST-P. And the intergenerational cycling created three possible trajectories, which we're going to look at in more detail. The first was the intergenerational child abuse. So that means a young adult who experienced child abuse and is using violence against their children, but there's no reported IPV, so no intimate partner violence, either experience or perpetration. Then child abuse experiences to IPV experience or perpetration. And lastly, the experience of intimate partner violence or the perpetration of intimate partner violence to the use of child abuse with no personal experience of child abuse reported by the young adult. So in terms of the drivers of intergenerational violence continuity that were included in this analysis, we had several variables that looked at deprivation, different forms of deprivation. It included food insecurity, the death of an important caregiver while growing up, living in an HIV-affected household. For mental health, we looked at suicidality, post-traumatic stress disorder, anxiety, and substance use. And we also had measures of gender inequitable norms. So this used for women the gender inequitable women score, and for men the gender equitable men score. And we also had a single item measuring gendered parenting beliefs. In addition, we had measured several attitudes. We measured attitudes towards that endorsed corporal punishment. There were 2 items. And we had a subscale from the parenting stress measure that focused on financial responsibility and overwhelm of parenting. And we had a measure of the age of the young adult when they became pregnant for the first time. This is obviously for women. And we included those who had a pregnancy before the age of 18 in the analysis. So this just shows you the patterns of these mutually exclusive outcomes. So you can see for women on the left and for men on the right. You can see that for women, about 1 in 5 experienced child abuse and also intimate partner violence, that a similar proportion experienced intimate partner violence and also used violence against children. And the third is the intergenerational transmission of child abuse. So the experience of child abuse and the use of violence against children. And for women, this occurred more commonly than the other patterns, the other trajectories. For men, on the other hand, we can see that a third who experienced child abuse went on to perpetrate IPV. And you can see the prevalence for the other 2 outcomes. So what I'm going to be presenting over the next 3 slides is a path analysis, which looks at the 3 trajectories, the 3 outcomes in a simultaneous path analysis, but it's broken up into 3 slides to make it easier to see, so that otherwise there's so many lines. So you can also see the color coding, so those that are related to deprivation, as well as those that are related to mental health. And you can see that for women, for this outcome of child abuse experience to IPV experience, that deprivation, mental health, and attitudes all contributed to this outcome, as well as adolescent pregnancy, which is difficult to read in the dark shaded rectangle. On the next one, you can see this is experience of IPV amongst women to the use of violence against children. And here you can see also that that deprivation, as well as mental health and beliefs, especially those around endorsing corporal punishment and gender inequitable beliefs, all contributed and were drivers for this outcome. And on the third one, you can see this is the intergenerational experience of the intergenerational continuity of child abuse. And here you can see the gendered parenting attitudes as an important contributor, as well as mental health and deprivation, specifically food insecurity and having a caregiver who died. And in all three, having a pregnancy before the age of 18 increased the chances of this outcome. We're going to move now to men. And this is the path analysis for men, looking at intergenerational continuity. And we can see two outcomes here. The first is the experience of child abuse to IPV perpetration, and the second is the intergenerational continuity of child abuse. And what you can see for men is that mental health, especially substance abuse, suicidality, and PTSD, all contributed to the use of IPV perpetration after early experiences of child abuse, and that gendered parenting beliefs and gender inequitable beliefs were also contributed to these outcomes, and that parental responsibility and financial overwhelm led to the intergenerational continuity of violence against children. And to move on to the key findings, what we, in looking at these analysis, we can see that hardship experiences in childhood, such as the death of an important caregiver, as well as living in a home affected by HIV and food insecurity, were noted for women, but not for men. Pregnancy before the age of 18 had a direct effect on all intergenerational cycling of violence. And while we looked to see whether it was mediated by mental health, we did not find that link. So we believe that it is more likely to be through social exclusion and through poorer parenting practices. And then in terms of mental health challenges, both PTSD and suicidality were drivers of intergenerational violence continuity for both women and men. And in our analysis, you will note that depression was not found to be on the pathway for these intergenerational violence outcomes for both women and men. But what was important was inequitable gender beliefs and the extension of those beliefs to how girls and boys, beliefs that girls and boys should be parented differently. And this contributed to the continuity of violence for both women and men. And lastly, parental stress related to financial burden of children and challenges balancing responsibilities related to children contributed directly and also mediated the relationship between food insecurity and these intergenerational trajectories. So with that, I'm going to hand over to my colleague, Natalie. Over to you.
Thank you, Nicola. And welcome, everyone. So just to say, the qualitative data collection was happening in parallel with the quant, and we were answering a very similar question: what are the risks and mechanisms for intergenerational cycling? We invited those who were experiencing violence to in-depth interviews. 79 were undertaken, and from this, 7 families were identified for a second round of interviews. You can see here the number of young adults, caregivers, and children in the sample. A multiple case study design was undertaken, and we used genograms to determine family structure with a reflexive thematic approach to analysis. So here's an example of a genogram, and each of those blue either dot or circle indicates who was interviewed in that generation, plus who else was living in those generations, living or dead. And really, our findings underscore 3 main themes that were evident against this backdrop of social and structural drivers of violence. One was unresolved aggression reenacted in the next generation. The second was complicated parenting arrangements leading to challenging attachment relationships across generations. And the third was subscription to inflexible injunctive norms, causing acceptance of marginalization across generations. And as a reminder, injunctive norms are those norms where I am the views of others and what I'm expected to do drives my behavior. And at the nexus of all of these was reenactment of the past in the present, underscored by incredible vulnerability within these families. I will speak about each of these themes and give some voice to our participants with their quotes. The first, unresolved aggression reenacted across generations. There were sub-themes of fearing anger, either denying it or not feeling like one can control one's own anger, displaced anger, violence justified through anger with no positive modeling of how to regulate it, physical violence in parenting, deprivation abuse in parenting, which often led to suicidality. A young woman who is 26 who experienced IPV in adulthood and physical abuse in her childhood shared insights around her own unresolved and displaced anger that was highlighted in her reflection on her parenting. It was very difficult, I won't lie. I was angry. I was an angry mother, very angry. I would get pissed off by people on the streets and take it out on the closest person to me, and usually it was my daughter. She would do a small thing like spill water and I would overreact, like I realized that the way I was hitting her was not normal. Physical abuse appeared the only kind of discipline to consider and was handed down across generations. A young woman who beats her own child or children shares, but you know, now in our older age, when we speak about it, we tell her own caregiver, that by beating us, she was actually helping us from doing bad things. Because if it wasn't for her beatings, we would be in the street smoking nyaupe, which is a street drug. She really helped us by beating us and putting us in the right path. Children seem to understand this accepted order. For one boy participant, 7-year-old, when asked what adults should do when children are naughty, he responded, they must hit them. They must hit us when we are naughty. The second theme of complicated parenting arrangements leading to challenging attachment relationships across generations had sub-themes of distrust and lack of safety in relationships, abandonment, unstable and multiple caregivers throughout childhood, multi-generational, multi-family homes, favoritism, absent fathers, and adolescent pregnancy. Strongly held beliefs seem to fuel distrust and suspicion, exacerbating feelings of lack of safety and adding to attachment complexity that was handed down. One woman participant reports, growing up, my mother always told me that I should never trust friends and never be too close to people because people will pretend to be your friend and then end up killing you. So I grew up not really having friends. One of my mom's friends once gave her muti, which is traditional medicine. She put it in bread on the side that my mom was eating from, and on her side there was nothing. And obviously my mom did not suspect anything because they were eating from the same bread. Living in multi-generational, multi-family homes seems to perpetuate an authoritarian parenting style, especially where young women and their caregivers lived, and both were young. I listen to the elders, and as I am also still under their roof, I am also a child. I don't do as I please because this is not my house. If they don't want something, I listen to them and also warn my children to discipline them because in the end, we need to all get along. And if we don't, that will just affect the children. Strained relationships between one generation and the next had serious implications when living in these households. For instance, now that they have cooked, even if they do not dish up for me, a woman who's 31 years old, they should at least dish up for my children. I have no problem them not dishing up for me. I can be able to survive even when I go to the neighbors. They can give me food, but I can't take the children along. They won't be able to dish up for all of us. When I did something wrong, my children have to also suffer because of my actions, and that doesn't sit well with me. Isn't it that I am the one who did wrong? The children did nothing wrong. Multiple parallel processes coexisted. Victims from one generation having experienced similar violence and its consequences, blamed victims of the next generation, unconscious of the repetition. All caregivers in the sample had their first pregnancies and children in adolescence, and all young adult women did too. All women during this time were highly stigmatized by those who had experienced similar circumstances historically. Adolescent pregnancies were fraught with complications in relationships, both between adolescents and their mothers, but also between adolescents and their children. One participant who would have terminated her pregnancy, but this was not acceptable to her family, described an insecure attachment with her daughter her daughter was delivered when she was 17 years old. Like I said, if I had the money, I would have terminated that pregnancy, but I didn't, and now she's here, and I learned to love her. Like sometimes when she sees you, she would scream, "Mama," and whether you like it or not, that will make you love that child. She's the love of my life, but also a pain. That child is troublesome. The last theme, subscription to inflexible injunctive norms causing marginalization across generation, had sub-themes of gender inequality, patriarchy, poor expectations of fatherhood, childism, which is an act of discrimination against children, authoritarianism, lack of freedom, and bewitchment. There was little opportunity to leave homesteads, limiting freedom on multiple levels, freedom of choice, of mind, of opportunity, with continuous interpersonal violence characterized by patriarchy affecting multiple generations all living together. Women in particular were expected to look after their mothers in their older age. A young woman shares, "I feel bad because when I look at the situation at home, even the neighbors start gossiping about us because they know that my brother is always running after us and hitting us. He just does anything and everything. They laugh at us because of this. Sometimes I even feel like I should just pack my things and go. My sister tells me that no one is going to leave this house and we all live here together. No one is leaving. Our father left us here at home and this is where we will also die. Where will we go? Will we leave our mother?" Strong views of gender inequality were evident. Backward, thanks, Brian. Across generations, impacting parenting and perpetuating risk for violence. One participant, a male participant, one of the few in this sample, who is 50 years old, indicated that social and community norms were the law, and he relinquished his personal parenting responsibility. By law, it is said that the child must be raised by their mother as opposed to their fathers. It's not that blessed if it is the father. There was nothing I could do. You can't really give a girl child rules as a father. When you do that, you will find yourself being insulted. They themselves must figure it out. What they are doing is wrong. His daughter started frequenting taverns when she was 15 without any supervision, which exposed her to violence and coercion. Her father didn't supervise her at all. So we have a few recommendations from all of the collective data and research you've seen. Our findings indicate that structural drivers that place families at risk need to be addressed. Harmful gender norms and attitudes towards violence need intentional engagement on multiple levels. Mental health needs adequate investment and awareness raising. Parenting support is indicated both through strengthening the parent-child or parent-adolescent communication as well as within relationships. The belief that corporal punishment is not harmful and is effective must be eliminated. The good policies and legislation that exist in many countries need to be enacted and upheld. Continuity of violence is common across the life course, and without deliberate and considered interventions to address it, it will lead to an obvious outcome. Interventions must be holistic and multi-pronged. Continuous traumatic stress is not tenable over the life course and perpetuates its own continuity. With that, I will hand over to Mpho, who is a senior researcher at Wits University. Thanks, Mpho.
Am I audible? Okay. All right. Thank you so much, Natalie and Pam and HP and Nicola and Francisca. We do have a couple of questions for the panel here. The first question was to you, Francisca, and it was how did we define emotional violence and neglect in the study?
Thank you. That's an excellent question. We used the ISPCAN child abuse screening tool to measure emotional violence and neglect. And emotional violence was defined as calling children hurtful names, telling them that they weren't loved, shouting at them in ways that was scaring them, so items that signified quite extreme emotional violence by a parent, basically, if that makes sense. And neglect was measured also through the ISPCAN tool, looking at, this is a good question, at failure to provide when you could have, not taking children to the doctor when you could have and could have afforded it, not caring for a child's needs, not providing food for a child when there was food in the house, and so forth. So it was a really tricky. I think neglect measurement is really tricky in this context, and I think this is probably a different discussion. I mean, neglect is probably tricky in most contexts, but particularly in contexts where poverty is high, we have to be really careful not to confuse neglect with poverty. And so we were quite pleased when we looked at the prevalence statistics from our neglect measure, that our neglect prevalence overall was quite low. It was something like 10% or 11%. So it was very low compared to emotional violence and physical violence, which I think the physical violence was about 50% individually for the young adults, and the emotional violence was something like 30 or 40%. But we have those statistics, and we can provide them to you if you're interested specifically in those statistics. And in the measurement of these. But I think, work needs to take place. This is a different discussion, but work needs to take place on the measurement specifically of neglect, and of how we define neglect in order so that we don't confuse it with poverty.
Thank you, Francisca. My camera's glitching. But the next question is for you, HP. This one is about the mental health assessment. So on the mental health assessment, since anxiety and depression can be a result of trauma, how did you separate anxiety, the assessment of anxiety, depression that is separate to trauma?
So that's a very good question. Actually, can I ask Natalie to chime in and assist with this? Because she has a deeper expertise on that measurement than I do.
Hi. So we use 3 measures. The anxiety, depression. I'm just trying to find them to answer this question, sorry, but there were 3 distinct measures that we used that have been used quite frequently in South Africa and other low and middle income countries. They haven't been normed and standardized, but they have been frequently used. And we did actually test a lot of these measures in our pilot. With our participants, we did some cognitive interviewing around some of these measures to see if they were answering the questions they were intended to answer. And then, the data came from those 3 assessments, or 3 screening tools. I will try to find them now. Sorry, I don't have them off the top of my head.
I can chime in with those. I have that in front of me, Natalie. So the measurement for trauma came from the trauma symptoms checklist for young children. I will put that in the chat. Anxiety came from the revised children's manifest anxiety scale, and depression came from the child depression inventory short form. So all of those, I think this question is getting at like the conceptual framing of like how do we distinguish trauma from anxiety and depression, which may be beyond the question, maybe asking more than just what scales we used, but we were using validated scales for that. Did I miss something key there, Natalie? Okay.
Okay. Thank you. I think this is for everyone really. And this question is, with all these findings, which are quite informative, what do we think can be done to support children who have experienced physical abuse, which in the long run, if not attended, can lead to adverse effects on the children? So I think anyone can take a stab at that one.
Do you want to go?
Natalie?
So that's a big question with lots of ideas, I guess. Sorry, I was getting a bit distracted by the Q&A. But so what are some of the things that work, basically? Is that what that question is getting at? Sorry.
Yeah.
Repeat the question. Yes. Okay. For families in particular, I think, any of those structural drivers, if they were improved in any way, would give families that are vulnerable a much better chance living in situations of poverty and where there is violence in the home, at school, and outside of the home. Diminishes your ability to cope for anybody. So if social protection systems worked and people had a place where they felt safe, you wouldn't be in a state of continuous traumatic stress, right? So I think there's some things that are kind of structural. We did have some sort of tendencies towards good outcomes, and they tended to be when children were treated the same in families. So there was no favoritism between, in multi-generational homes, sometimes an auntie is looking after her kids as well as other kids, and sometimes they're not treated the same. So in families where the rules applied the same way to everybody, and there were shared resources, some kids didn't get more than others, they were shared. People tended to do better. There were sort of positive changes towards good outcomes, as well as awareness of the violence. So I think another piece, sorry, and then I'll hand over to somebody else who wants to chime in, but a lot of this violence, when it's so normal and you experience it everywhere, you often don't name it. You don't often say that's this thing, and that's not okay. I mean, I know it's not okay, but this is what this is. Once people start naming violence, it leads to an awareness of maybe doing things differently in one's own parenting or in one's own life. So I think people very rarely get the opportunity to have those discussions with people who listen, to be able to sort of step back from it and think, how would I want to do this differently? If this is what happened to me, do I want to do that again? Or how could I do it differently? Let me just even brainstorm it, So I think awareness raising and naming violence for what it is super helpful in families. But anybody else want to have a go?
Yeah. Yeah, I think this is all, obviously I agree. But I also think, we know that there are evidence-based interventions that do work, and that can help parents in in any type of situation. I mean, they're helpful for any parent, but they're particularly helpful for parents who who haven't had a good example of how to parent, or who are particularly stressed by their circumstances. And I think what we often forget is that those parents that are really stressed by their circumstances tend to not attend these parenting interventions, or these other types of interventions that are supposed to make their lives easier, because it takes a big step to add that to your already stressed life, and to engage with these kinds of resources. I mean, I think many of us who are parents can, that resonates with many of us who are parents, that if you're already stressed, that you don't want to focus on something new or learn something new. And so I wonder whether generally having discussions around what is available, if there is something available, making it okay to talk about difficulties with parenting, making it okay to talk about difficulties with child behavior in our communities, to make it clear that we're all kind of struggling, and that we are, that nobody is a perfect parent. And I wonder whether that will help also kind of help people reflect on actually what's happening within their parenting, and their ongoing, well, in their life generally. But I do think that we really have to also come back to these evidence-based interventions that we know are working. We know that some of the gender transformative interventions are working. So having clear discussions, like if you work in a field where you're working with boys and girls, having clear discussions around around gender, and around basically that there around gender roles, and how we are imprinting them on children, and how we're carrying them forward to the next generation, and how harmful they are, and how we would how kind of trying to model in your families, in your communities, a different type of approach to gender than what is often lived, I think will help quite a bit already. But all falling back on these parenting interventions, falling back on evidence-based gender transformative interventions, falling back on economic interventions that are supporting families. All of these things are necessary. And we do know that ideally we're combining them with each other, and we are aware that it's not just happening in one generation, or it's not a one-person problem, but it is a whole family problem. It is a whole community problem, this violence continuation. And we need to, make sure that that these resources are provided to families, whether they are online or whether they are, and that we are kind of making it okay to access it, and that we are, regulating, making it sure that people are able to use these things with through online media or whatever. Like, I think we need to think creatively about how we can get this to people when group-based interventions are too expensive.
Does anyone else want to chime in from the team? No. Okay. This one is related to something that wasn't really discussed in the presentation. It's regarding disclosure. The question is, you didn't talk about disclosure and help with abuse. Was this something participants talked about? And what should we do to help with this? I think, Kopana, you can give that one a shot.
Thank you. Hi, everyone. Okay, so my study was part of this bigger project, and my research specifically focused on barriers and facilitators to disclosure. And yes, participants, okay, so my study population was young adults. And then we asked them about their childhood abuse experiences and disclosure. So yes, some of them had disclosed abuse in childhood, and a few of them actually disclosed for some abuse experiences for the first time during our interviews. Yes, and then what we should do to help this, I would say first and foremost, we need to foster and advocate cultures where it's clear that violence is wrong and that survivors are never to blame. In terms of institutions such as schools, clinics, community centers, for example, I think this can be achieved through confidential reporting channels, and just accessible support networks that build trust. In terms of practice, it's important to ensure that professionals such as healthcare workers, educators, the social workers, law enforcement even receive regular and culturally sensitive training on identifying signs and supporting disclosures. So early detection mechanisms, which can help identify at-risk individuals and try intervene before harm escalates. I would also say that to add to that, coordinated multidisciplinary approaches are essential, because when professionals across sectors work together, we can provide comprehensive care that addresses survivors' full range of needs. I hope that answers that question. Thank you.
Another question. There's quite a lot of questions. So one of the questions, this question is to you, HP. The parents' reports of their own childhood violence was far lower. So I think it's just the question is about how do you explain that that the parents' reports of their own childhood violence was lower than what the children were reporting, basically.
Yeah, I think you touched on it, Mpo, which is that when I think we need to think about recall and memory and the time at which we're asking these questions. So we did ask young adults to tell us about experiences of violence and neglect that happened in their childhood and relative frequency and severity of that. But again, an advantage of this study is that we do have children, particularly young children, and so we can ask about what is currently happening. So I think if we're seeing lower rates reported by the young adults than compared to their children, that could be because of recall bias, recency bias, any of those causes. I mean, there's always the possibility that violence is increasing, that the children in this generation are experiencing more violence than their parents. But based on the qualitative data we're getting and these stories that we're getting from the families, I don't think that's the case. I would say it's probably fairly consistent. And I think that also speaks just to the value, the power, the urgency to include children, including young children, in samples where we want to understand what's happening in childhood around violence, that we can get probably the best data. And obviously we can respond more quickly because the data won't be 20 or so years old if we include children and we ask them what's going on.
Yeah.
Oh, Natalie, and Natalie wants to chime in.
I'm not sure, Pam, if you'd agree with me, but from a lot of the qualitative stories, I would say that many one thing I saw was that people of one generation felt that they were parenting in a less severely harsh way than how they were parented. I don't know if that's sort of the opposite here of this question, but it was quite typical for people to sort of be like, and I don't think that that's atypical in other places. Like, well, when I was growing up, it's, I had to walk to school or whatever, and my kids have it much easier, kind of, that things have changed over time in societies, and that people's perspectives on their own parenting seemed to be that they were it was less harsh than what they had experienced themselves, which is contrary to the question here. But that did come up as quite frequently, and that people felt that because they might not be hitting their children, but they were verbally quite abusive or emotionally quite abusive, that didn't count. It wasn't quite as destructive as what they had experienced. So there was some change in some ways, but it was still violence. That was the experience of the younger generation.
Yeah, and I mean, just to add on that, I do fully agree with you, Natalie. The one part that I really wanted to highlight was that it's almost a shift from one type of violence to the next. Even if it's not physical abuse with a stick or a belt or with an object, it could be pinching or slapping, something that they would perceive at that moment as less violent or as a lighter type of punishment, because mostly it's in relation to corporal punishment. And I think what I'd like to highlight here specifically to corporal punishment is it fits into this idea that it's almost like there are no other alternatives now to discipline children, like in all of these generations, almost like the YAs, the young adults would be saying, well, my mom would do this with a stick, but at least I just shout, almost like there are no other alternatives that are outside of violence to actually discipline and communicate in a age appropriate. As we know, like as children are growing, things would happen that they would misbehave. All of this is normal, but outside of that, it's almost like they know ways that they would employ that would be appropriate and are not related to violence, basically.
Thank you for that. And another question, I think this is for the whole team. How did we reflect about conducting research that was led principally by West researchers in a global South setting? How did you tackle the risk of replicating colonialist power dynamics? Do you want to go for that, Francisca?
I think this is an excellent question and always a danger. Just to highlight it, the question was collaborative in nature, and the study was collaborative in nature, and we were working quite hard to reflect on these dynamics. But yeah, I mean, part of the team is based in Edinburgh. Part of the team is based at Wits. That was the nature of how the funding also worked. But you're right. I mean, it is a tricky one. And we did, particularly for the qualitative findings and for the quantitative findings, reflect. So did we interpret this with a view from a high-income country? Are we being judgmental about what we are seeing here? Is this what can we do in order to equalize some of these power dynamics, which were partially inflicted by funding and partially, obviously, also inflicted by my interest in the topic and my involvement with these study kits since 2010. I think the aim obviously is to ensure that as part of the project, we are building young researchers from South Africa so that they can carry out further studies so that at some point we can hand over and in whichever way, is deemed desirable and fit, these studies may continue or not. But I think it's a good question. I don't really have an answer there is no right answer, I don't think, to this question. We were trying to be sensitive about it. We might have failed, we might have succeeded, we might have done something in between. I don't know. Natalie or Nicola, do you maybe want to reflect?
Or Pam or Mpo or Kapano.
Oh, that, yes. I did.
Yeah, just to say that, you know, the very nature of the research is, you know, sort of like using quantitative methods in the particular way that we did is colonial. So I mean, there is that aspect to it, but we did also really want to use some more participatory methods, really, you know, that enabled listening to communities, listening to the issues, and so we tried to blend some different things together. But I think it is an area, you know, sort of that research needs to tackle, regardless of the setting. But certainly, you know, in the South African context, I think it is a very important. There are many power dynamics in South Africa also that have to do with race and other, you know, sort of issues, socioeconomic class and so on. So all of these come into play when we are talking about research in communities that are largely characterized by poverty and disadvantage. So, I mean, that is a reality that we are facing continuously. Yeah.
I would just add one last thing and just be sort of, I mean, you're speaking about values clarifications within teams, and I think teams can be very intentional about that and get to know your team and the field work. So just to say that the investigators, everybody here was very close to the data, in field together, learning together, and iteratively sort of like discussing findings as they were happening together. It wasn't, I think there's something important about primary data collection and being so close to the data in field together that also builds teams. Yeah, I think that's another important piece.
We're almost at time and there's still tons of questions. I'll take another one. This is related to poor mental health.
It's
and
very
how-
hard to hear you. Can you please speak up a little bit with the question? Thank you.
Can you hear me? Can I hear enough?
It's a little bit better. Thank you.
The next question is related to poor mental health and how it affects parenting. Question is, can you tell us about how intimate partner violence and mental health interact? As we know, women who experience intimate partner violence also experience mental health. Okay, I will tackle that one. So as part of my PhD, which was also nested in the Banagegeli study, I actually looked at the pandemic of intimate partner violence, HIV, and poor mental health, and how these epidemics basically interact in ways that worsen each other. And what we worsen each other amongst women who were primary caregivers of young children. And what we found was that the combination specifically of intimate partner violence and poor mental health interact in ways that worsen each other and have a profound impact on maternal use of emotional violence towards their children. We found that about 21% of maternal use of emotional violence was actually attributed to the combination of intimate partner violence and poor mental health. More so than any other combination, and more so than just intimate partner violence and its impact on parenting, harsh and inconsistent parenting, more than mental health. So we did find that that it's very important when developing interventions to tackle both intimate partner violence and poor mental health among parenting women. And as we've found in a lot of parenting programs, they'll either focus on just intimate partner violence or just mental health amongst parents. But tackling both of these is very important, especially in resource-limited settings. So, yeah, so we did look at that. It just wasn't part of the presentation today. I think we're at time.
Perfect. Thank you, everyone. We are at time. There were a few questions that did not get answered. I believe on the Interrupt Violence website, Francisca, there's a contact option, correct? So that might
there's
be,
a website option. There is a contact option, but we can also, yeah, people can look at the research findings online. We have all of the questions on our website. Sorry, not all of the questions, all of the papers on our website.
perfect. So you feel like people could find the answers to any questions that we may not have gotten to. The only question that kind of came up more in the chat maybe than the Q&A that you might not have seen was kind of this question around desire. So did you find in the study, and maybe it's just not something that was measured, a desire to break these cycles of violence, a sincere desire to, for whether it's parenting interventions or community interventions where kids work, play, learn, and they also experience violence? Did you feel like there was that wave that could help with change?
I would say that just to kick us off, and Francisco can jump in, I would say that many parents were actually not aware of the cycle of violence, so they hadn't actually reflected on the fact that what they were doing was similar to what they had experienced. So so I would say that part of it, I think those who saw that pattern had a strong desire to interrupt it, to stop it, but it actually wasn't always, that evident that participants were able to reflect on those patterns of continuity of violence.
Yeah,
Thank you.
I just wanted to bring Christina in just to say that we did test some of the interrupters for this continuity, and Christina was leading on that analysis. So maybe Christina can also say something, not about the desire, but about what actually potentially might work.
Yeah, I'm happy to jump in if you can hear me.
Yes. Perfect.
Okay, perfect. Yeah, so it's less about desire, but I guess about tangible kind of perhaps intervention points. So we're doing a quantitative analysis looking at longitudinal data on how we can interrupt this intergenerational cycling of violence and looking at whether certain factors, either on their own or together, might reduce the risk of this violence continuing across generations. So I guess I should say this is all preliminary and exploratory for now. But we tested things like food sufficiency, caregiver education, employment, a household being HIV negative, equitable gender beliefs, which came up a lot throughout this webinar today. And individual protective factors do seem to matter. So, for example, in our study, when caregivers had stable schooling or when households avoided severe hunger or had a food garden, sustained access to a food garden, the predicted probability of intergenerational maltreatment lowered by like 9 to 12 percentage points. However, when you're looking at combining these protective factors, they seem to work better in combination. So again, like if we take intergenerational child maltreatment, so that is the young adult experiencing maltreatment in their childhood and their caregiver also experiencing maltreatment in their childhood, basically looking at single factors were modest and significantly protective, like food sufficiency, a food garden, caregiver employment. But when you combined them all, it resulted in a 50 percentage point reduction in the intergenerational continuity of child maltreatment. So it seems to be like these protective factors, or I guess promotive factors, or actionable kind of intervention points at policy level, for example, HIV treatment and access, to kind of equitable healthcare. These things together might kind of have a multiplicative effect on kind of interrupting that continuity. So yeah, it doesn't seem to be a catch-all solution, but looking at things from a multi-pronged angle, you know, school education, health, parenting, looking at that all together points us to interventions that might help strengthen families and interrupt that cycle. So yeah, I hope that kind of helps give an insight into the things we've been looking at to interrupt the continuity.
Actually, very much. And you gave multiple points of intervention, which should be a real source of hope for everyone.
Yeah, hopefully there will be papers looking at not just the negative and the kind of more despairing results, but also some promising solution-focused papers. So yeah.
Thank you, Christina. So I know we're at time, so I want to be respectful to that. Francisca, I would, want for you, if there's any closing key takeaways or remarks. I do want to ask our audience members, one, thank you so much for joining us, and thank you to our presenters for being here and sharing your time, your expertise. This report is so impactful and so well received. I'll send you the chat log. I know that you were busy presenting, but there was so much incredible positive feedback, and really that the impact of your findings can just be replicated and transferred to multiple communities. So thank you for that. I do want to ask our audience members, as they disconnect, they'll see a survey come up in Zoom, and that gives you the opportunity to really provide feedback directly to our presenters. I will make sure that they get that information. So appreciate that as well. It just takes 4 questions. When you disconnect, it'll pop up. But Francisco, besides our sincere thank you to SVRI and to your entire team, any parting words you want to leave us with?
Well, it takes a team approach. So I just wanted to thank the whole team for making this possible. And then I think in terms of takeaways, I think each and every one of us should really look at their practice and look at how they can potentially change things in their community in their own little ways, or in their bigger ways, depending on where they work, influencing policy, influencing their community, thinking about the different kind of risks that we talked about today, and hopefully in the future, talking also about some of the positive things that we might find that can interrupt these cycles, but really supporting families, reducing the structural risks, and gender equality, and talking about harmful gender norms, or like talking about equitable gender norms even better. I think really, really important in order to make some headway, and talking about violence, talking about mental health, also really important, to get these channels to open up and to start the conversations.
Well said. Thank you so much. And again, a heartfelt thank you to your entire team. We will send the recording and the presentation slides, links to all of that, a certificate of attendance. So appreciate it. And want to say really good evening, good afternoon, wherever you are. And again, sincere appreciation for you spending your time with us. Goodbye, everyone.